Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Lee Scheinbart. He's a medical oncologist. Today's KevinMD article is titled A Memorable Day During COVID, Staying True to My Calling. Lee, welcome to the show.
Thanks, Kevin. Thanks for having me.
So let's start by briefly just sharing your story and journey to where you are today.
Yeah, so very traditional path. Came out of a small town in Ohio, went off to college, went off to medical school, and entered into the field of hematology oncology. And then around 2013, I drifted into administrative work and became the director of our local cancer center, and then became a vice president of medical affairs in our hospital system, and ultimately the chief medical officer, which I was in that position through COVID until last summer, and I elected to take a career leap of faith and go in a different direction. And I ended up in medical education, which is what I'm doing now.
All right. Tell me about that transition from medical oncology to medical leadership, now to medical education. So, talk about your latest transition.
Yeah, so, and part of it is reflected in the article that I wrote, the attempt to really stay true to finding what motivates me, my calling. And at the end of my time as a chief medical officer, I was losing touch with the calling. And it was time to take some space and find out what that looked like. And that's how I ended up drifting into medical education, which is serendipity. Our area has no local medical education, no undergraduate or GME, and a group had been looking to put something together. I had gotten to know them over the years in the CMO role, and I took an opportunity when they approached me and said, "Hey, we understand you're stepping away. Perhaps you're retiring. Perhaps you want to come out of retirement and do this work with us." And I said, "Yeah."
All right. So, you're going to talk more about your story, about what led you to that in your Kevin MD article, A Memorable Day During COVID, Staying True to My Calling. Now, tell us, how did your article come together?
Yeah, so when I told my colleagues and friends that I was going to leave that career as a chief medical officer, it was very confusing for people. They didn't understand. And I had a hard time articulating that deep sense of I wanted something else. And through the act of the writing that piece, which I then shared at my going away party, people tended to understand what I was doing and what I was looking for. The day that I referred to in the article was sort of this awakening, and it came into my feelings and then into my brain later. And as I wrote it out for the going away party and then put it into the article form, it made a lot of sense. And I can go into a little bit more detail of what happened that day if you'd like.
Yeah, absolutely. For those who didn't have the benefit of reading your story, tell us what happened.
So Florida is where I live, and it was a difficult place to manage COVID. And as the chief medical officer, I was in our hospital incident command as our med tech specialist and really running the clinical response for all four hospitals in our system. And it was, as for everybody else, day in and day out, wash, rinse, repeat. And it was very challenging. And I reached this point during the Delta wave in August when we were really assaulted by the number of patients that were seeking care. And I'm sitting at my desk like I am now, looking at a computer. I have all this data in front of me and all these requests and all these needs. And we got an email request to start publishing in our daily report certain statistics that weren't sure was a great idea. And my boss, the CEO, he really jumped out of his chair and made some wild statements about that, which triggered me to jump out of my chair and run and shut the door so nobody outside our command center could hear what we were talking about. And he and I had some choice words later, and I wasn't sure if I was going to maintain my employment. But what was happening to me at that time is if you looked at me, I was wearing scrubs, I wasn't shaving, I was down from my fighting weight, and I'm staring at this computer all the time and doing all this work all the time. And I'm sure people out around me thought, he's going to lose it. This is classic burnout. He is depersonalized, he is fatigued, he's not taking care of himself. And I will tell you, I didn't know day, night, hour, weekend. I was zoned in. I was in a place where it was like when I was practicing medicine, and I didn't know. I'd be late with patients because I enjoyed the interaction. I'd sit in tumor board and forget what time it is. And I really figured out that I was meant to be there. That was good for me. And it was part of who I was, even though to the rest of the world, it didn't look like that.
Sure.
But once it was over, I couldn't get the feeling again. And that's what led me to start thinking about, how do I get that feeling in my life again?
Hmm.
And I began to calculate a transition away,
Sure.
get some space, and see what would happen to me. That's kind of it in a nutshell.
Tell me that interaction that you had with that CEO during that day. What kind of statistics did he want to publish that that kind of triggered that interaction?
So the specific question, not verbatim, was generally around, could we in the command center not only publish our daily census of COVID, non-COVID, and we reached a point where 50% of our inpatient census was COVID, which compared to New York and other cities early on, it wasn't as high. I mean, they were at the 90, 99%, but for us, it was a substantial amount. And in the Delta wave, the vaccine had already come out about 8 months prior. And people began to ask, well, can you tell us how many COVID patients, how many have had vaccination, and how many people are dying with or without having had or declared a vaccination? And that was a sensitive topic. Everybody remembers how political, and perhaps it still is, and how people were approaching their sense of well-being. And that just really got everybody going. And the CEO felt that there was no reason to discriminate in a published report what people had or had not done.
Mm.
And he literally said, people die in a pandemic. That's what they do. And that was an explosive, an explosive phrase. It came from his heart, Kevin. I hope I don't mislead anybody. It just came out.
So after COVID has abated from its peak, you were starting to reevaluate what your next steps were. Like you said before, you're trying to get that feeling back. So as you were reflecting on that, what options were available to you at that time?
That's a great question. I think the first thing was to really just do nothing for a while. If I was going to be retired, I really needed to understand, what did that feel like? What did that look like? And and let things happen to me, because in medicine, so many things happen to us that feel out of our control, or when asked to, hey, would you like to be a medical director? Next thing you know, they ask you to be a vice president. Next thing you know, they ask you to do something else. And most of us just tend to fall into that. So I wanted to let things come at me and then take time to process those things. And a mentor suggested I read a couple of books, From Strength to Strength and The Second Mountain, both by Brooks. One is Albert, one is David. They're not related. And it really made me think about, is it time for me to give back? And what does that look like? And how would I do that? And would that generate the feeling that I'm looking for? So I just took this space and time to listen to all that.
How much time did it take you before you decided to go on the path that you did?
Yeah, a couple of months. It happened quickly. So by August, and I'd been not fully employed for a couple of months, the leadership of the medical education program came to me and said, we're going to keep doing this, and we'd really like some local help. And I said, well, let me do this at a part-time level so that I continue to have space to think. And over time, I found myself, it was like a magnet. I enjoyed it. I got to go to the pre-medical student club at the local university. I got to work with some of the medical students from the parent campus. And I found that teaching and talking, and then later writing, which is something I had forgotten that I enjoyed, really brought me to a place where if I can teach and provide guidance to all manner of folks in the medical field, that would give me back some of that sense of things. So that's what I did.
So hypothetically, let's say the pandemic didn't happen and you weren't exposed to that intensity that you were describing during the pandemic. Do you think that you would have continued being CMO if the pandemic didn't happen?
No one has ever asked me that question, and I've never given it any thought. But if I were to just speak from the gut, I would submit to you two things would have happened. I would have continued to stay in the role and possibly even continued in that physician leadership arena, but I probably would have left anyway because my wife and I had dedicated a plan anyway to make a transition at this point in my life. And that would have started to take a priority as to what we wanted to do for each other and for the family. So that's my quick answer to that.
Now, I talk to a lot of physicians. I hear a lot of their stories, and a lot of them are at similar crossroads to what you were describing. Perhaps they're losing their passion. Perhaps they have forgotten the reason why they went into medicine in the first place, and they're at that career crossroads. Tell us what kind of questions should they be asking themselves to help guide them as to what their next step should be?
Yeah, no, that's really important because again, even as I tell the story to you, I can sense how it can be confusing. I was busy, I was working hard, but I didn't feel the what people describe as burnout. I was exhausted, but it was kind of that good exhaustion. But then you have to come down after the crisis. You do that in the military, you do that in first responder life. You have to come down and you have to regroup. And so the the passion that I was feeling, I also knew was going to fade, and I wanted to make sure that was part of my life. So the number one lesson is to really listen to yourself and take the requisite time. And it's unfortunately, it's not a day off and it's not a week off. That you really have to take a chunk of time, and only a clinician knows what that means. But you
Mhm.
have to take a chunk of time and you have to ask yourself a lot of questions. What did I like? What didn't I like? Why didn't I like it? Why did I like what I like? And do that reflection and figure out, what are your internal motivations? And that's part of leadership, and that's part of, getting older. What are you capable of? And I would submit to you the work that all of us have done and in that mid-career zone. We're working harder than ever. Everybody knows that. Nobody's actually calculated that. But if you do a time study, I guarantee we're doing more tasks per patient than in the history of human medicine ever.
One of the things that you mentioned earlier was that when you talk to your colleagues and friends and maybe family about your transition out of that leadership role into medical education, they were a little bit perplexed. They weren't quite
Mhm.
sure why you were doing what you were doing. Tell us more about that reaction.
I think that the folks around me must have sensed that I enjoyed the role, and took the responsibility seriously, and seemed to thrive. And I'm trying to articulate that I was. So they thought that was a disconnect. How can somebody at the top of their game want to make a transition? And I think that's part of the difficulty in medicine. We do find ourselves doing a little bit of surface, or what they call surface acting, but deep down you're feeling something else, and there's
Sure.
sort of a misalignment, and you walk into a terrible trauma bay situation. You've got to put on your game face. When you're telling somebody they have a terminal illness, you have to put on the right face. But sometimes you're not feeling that, and so there's a gap between what you're doing on the external and what you're feeling on the internal. When they're together, you feel really darn good. When they separate, it doesn't feel that good. And there's a lot of terms and a lot of people. I'm not a researcher in this area, so I think that was probably the disconnect. I didn't express to people what was really happening inside to me. They only saw the external, and so I had to find a way to close that gap for them, in fairness, and for myself.
And as you reflect on this experience, if you were to replay this scenario again, is there anything that you would have done differently?
Probably not.
We're talking to Lee Scheinbart. He is a medical oncologist. Today's KevinMD article is titled A Memorable Day During COVID, Staying True to My Calling. Lee, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Yeah, sure. I think what I've discovered is unlike maybe a few generations ago, certainly even just one generation ago, medicine is no longer linear. It is no longer a pathway where you get your education and you spend 40 years doing the same thing day in and day out. And people still have that mental model, and I think we need to be more open to the fact that it is a nonlinear career, and we need to learn how to be adaptable. And we weren't necessarily taught that in our training, where it's a very rigid sense of how you need to be a skilled, competent physician, and it doesn't allow for that kind of weird trajectory that a lot of other people go through in their careers. And really just try to listen carefully to where you want to go in that kind of variable path in life, and don't be so locked in that you're stuck or you have to do it this way or it has to be this way, and kind of wiggle around a little bit, see what that feels like, and get out of your comfort zone.
Lee, thank you so much for sharing your story, time, and perspective. And thanks again for coming on the show.
Thank you, Kevin.